السلام عليكم ورحمة الله وبركاته. يشرفنا اتحاد الحر نقابات عمال البحرين، لجنة المرأة العاملة والطفل، تنظيم فعالية توعوية في لسرطان الثدي في شركة صلب بالتعاون مع نقابة صلب. الشكر الجزيل لدكتورة مريم الجنيدي، أخصائية جراحة، استشارية جراحة وجراحة ترميم من مستشفى بالنفيس، وبيكون بعدها إن شاء الله أخصائية التغذية أستاذة سارة سعيد بتكون تعطينا عن نظام التغذية في للوقاية من سرطان الثدي. حياك دكتورة.
صباح الخير. طبعا في بعضكم أنا أعرفهم إنزين، واللي ما يعرفني أنا دكتورة مريم الجنيد، استشارية الجراحة العامة وجراحة الثدي. سويت تخصصي في جمهورية ألمانيا في ديزلدورف وفي ميونخ. اليوم ما أبي أخليها لايك فورمال نفس المحاضرات إنه متلقي، يعني أنا أحاضر ومتلقي. نبي يعني أنا أحب محاضراتي إن تكون أكثر كإنتراكتيف، تكون في يعني مشاركة، على أساس أبي أعرف إيش كثر أنتم عندكم معلومات، ونبي نعرف شنو أنا اللي مفروض إن أضيفه عليكم. طبعاً بنبتدي بفيديو صغير. أبرار ممكن نشغل فيديو. طبعاً تعرفون إن إحنا ليش نهتم بسرطانات الثدي أو الأورام الخبيثة للثدي؟ ليش كل هالاهتمام تتوقعون؟ لا just wait. ليش نهتم بها؟ لأن وجدوا أن الأورام الخبيثة للثدي تشكل تقريباً في العالم الغربي 30% من الأورام عند النساء، يعني هي أعلى رقم واحد بين الأورام عند النساء. وطبعاً عندنا يمكن قد تكون النسبة more or less the same 35 to 40 with an average of 37%. يعني تبوني عادي أتكلم بالإنجليزي والعربي ولا في there are people who are not speaking Arabic؟ كلكم مرتاحين بالإنجليزي؟ Okay. Today we are highlighting breast cancer not for any reason except that breast cancer having the high prevalence among women breast cancer. It's not only here in the Gulf, but also worldwide. Okay, breast cancer will constitute around 30% of all cancers in women, followed by colon cancer, اللي هو تقريبا 15%, around 15%, and then by ovarian cancer, which is 5%. So, because of this percentage, so it's important, and because of another reason, breast cancer recently have changed in the behavior. Maybe you can notice. يعني okay, question حقك. كم أعمار اللي تعرفينهم مثلاً اللي حوالينك around you, how old they are when they were diagnosed with breast cancer?
Yeah, my auntie was, I think, on 30.
Okay.
37.
Okay.
When they
Discovered. Anybody else have like an experience in the family with the breast cancer? In any member of the family? Yes.
I am.
Yeah, you are.
Yes.
What age you got it?
55.
55 also. It's considered reasonably young. So that's why, yeah, you also? Yeah.
My auntie, 38.
38. Yeah.
Cancer, and my mom in beginning of 50s, bone marrow.
Bone marrow, yeah. So, another documentation that, what is it? في myth. One of the myths, تعرفون شنو myth? You know what is myth? Myth يعني خرافة. That something people talk about it, but it has no scientific and no medical rule. And it's completely wrong. One of these myths is that cancer is of an old age group. We can say that it is partly true in the Western world, in USA. In USA, it's still that the average age of the women, they have breast cancer is 62, 63, which is not that young. بينما, on the contrary, in our countries, the average is like 45 to 55. It is like 10 to 15 years younger, in which, although outside in the USA, Europe, they have noticed that there is an increase in the number of the young generation. It's like now it's going higher up to 25%, but on the contrary, in our countries, is still, as you said, شوفوا, يعني from the examples, like all of you, they were young. The median age was not in the 60s, right? So we consider it as a young age group. So if you are young, if you have any changes in your breast, please, you have to consult your breast surgeon, or at the beginning, your family doctor, whatever, and then they will direct you. At this short video, I will highlight some of the myths that people they are talking about, and it has no medical science. We can start.
Keep pushing! If you keep up a healthy weight, exercise regularly, and you eat right, you won't have to...
Yes. Yeah, complete it, just the sentence.
About breast cancer.
Yes. Yeah. What he's telling the trainer, he's telling, yes, part of his talk is true and part of it's wrong. You exercise, you eat well, and you won't get breast cancer. You won't get, it's not, you will reduce your chance. Actually eating well, before even 7 years or 10 years, we were talking about eating well in general. Healthy is good for you, and exercise is good. But we were talking about it, but we are not sure if it is, it's not like we don't have a calculation and percentage, right? But these days we are fully pretty confident because we have statistics. We know that exercise will reduce the risk of a breast cancer by 10 to 15% or even 20%. And there is one more important information. Do you know what is the BMI? Any of you know their BMI? What is the definition of BMI? كثافة كتلة الجسم أو كتلة كثافة الجسم, right? In Arabic, any one of you know that?
We know of it.
And then how you figure out if your body is an ideal, your weight is ideal for your height or not? Yani how, or you don't care about it?
Weight, height.
Yeah, and how you yes, exactly. That's what I'm talking about, the BMI. They found that not only exercise will reduce the risk factor, if you are even exercise, and you know, by the way, how much the exercise you have to get? According to the American Cancer Society, they define that the exercise should not be less than 150 to 300 per minute per week of moderate exercise, or 75 to 150 of vigorous exercise per week. Okay, so there is a calculation, and this calculation is quite different also for the children. So it's not only exercise, it's also you have an optimal BMI. You know what is the optimal BMI? That my weight will be range from 18.5 to 24.9. And they have figured out that the BMI of 30 and above, and especially 35, have a dramatically increased risk of breast cancer. Okay? Abrar, we can go on. We will talk about another myth.
That's a myth. Although healthy behaviors can lower your breast cancer risk, they can't eliminate it. Got it?
I don't know. I just gotta get it over with, just get on a mammogram.
Oh, sweetie, trust me, you're way too young to worry about that.
Oh,
Not true. Young women can
Yes.
and do.
This point already I talk about it, because what happened that always you seek the advice within the family, and most of the family members, they are not doctors, and they are having the previous versions and the previous trends that cancer, the concepts that cancer of elderly, it's not anymore. Because here we heard it's 37, 37, 35, 55, it's all young age. So what happens that if I got the message that cancer is not a disease of young, then whatever I have changes in my breast, I will ignore it, and then I will present late. Okay?
start discussing your breast health with your healthcare provider.
Luckily, I canceled the mammogram I had scheduled. I had no idea how much radiation those things expose you to.
Oh, that's a myth.
Yes.
The truth is,
See, she canceled her mammogram and she went on a trip. So actually, the radiation she is exposed from the trip is more than the radiation which she will get it from the mammogram. You got it? So this is completely wrong. This is a myth. لأن أنا, it happens for me, a lot of my patients, they send me in my WhatsApp, doctor, see what, there is a study in Switzerland, there is a conference happened, and they will cancel the mammogram. Actually, I attend all the conferences everywhere in the world. Still mammogram, some societies, they are like anti-mammogram, anti-X-rays with nature, you know, and this has no scientific basis. Still, the mammogram is the cornerstone to start with for any guidelines in the world, okay?
exposed to low doses of radiation every day, from the radon in our homes to flights on a plane. While mammograms do expose you to radiation, it's a very low dose and safe. You know, wearing an underwire bra can actually cause breast cancer. There's actually no evidence that wearing a bra causes breast cancer. Plus, that one's really cute.
Yeah.
Thanks.
Okay. This myth, we like to highlight it, but it's not very important. Very important because for me, I divide the myth in a very priority that I have to change the mentality of like the age. You know, this is a very important, the age, the mammogram, because this will make a change in the presentation, because the patients, if they believe that they don't do mammogram, they will present late, right? And the patients, if they believe that they are young to get breast cancer, also they will present late. Presenting late means for me what? It means that late diagnosis and then poor prognosis. For me, you wear a bra with underwire or not, because before, just to give you what is the background behind this myth, that they are telling that the underwire bra will constrict the lymphatics and this will cause breast cancer. Actually, for me, it's either you wear it with the wire or not. Even if you decide not, this won't change your prognosis, right? Because by the end of the day, it's not a risk factor. Yeah.
4 more books to go, and you're going to look amazing.
Plus, it's way less than a mammogram, right?
Yeah, no, that's a myth. While getting a mammogram isn't super comfy, it only lasts a few seconds. And many women don't find it painful. It's high time we put an end to all those
Yeah. هاي دكتورة فاطمة. شفتي كل البيشنتس كل الفيميلز يقول لها she is cosmodermatology and dermatologist, and it's way more painful than the mammogram. And actually the mammogram, the new machines, the 3Ds, we have a very يعني في مستشفانا ابن النفيس and most other places doesn't require, you know, to compress the breast. And the idea, انتوا قد مرة فكرتوا, have you ever thought why we have to compress the breast? Have you ever thought what is the rationale or the theory behind it? I compress it because I want to get the view from craniocaudal mediolateral. So I have to include all the breast, including the axillary breast. So I will not miss a single millimeter from the breast. You got it? خلاص؟ يعني تروحون, you do filler, you do botox, I don't know, million every month عند فاطمة هذه هي شغالة أنا أدريبها, she's working, I'm one of her clients. And then when it comes to the mammogram, it's painful? No, come on, please change this attitude. We are done with the video or still?
misconceptions around breast cancer and mammograms.
Okay, so yes, what other myth you heard about it and you want to confirm from me? What other things you are not sure about it, that it causes breast cancer? One of the most dangerous myths that people still, educated people still, they are talking about it, is taking a biopsy will lead that the tumor will be flare up and it will be like spread all over. And this is, I consider it one of the most dangerous myths because it will delay that the patient gets a diagnosis and then will delay the treatment. Have you ever heard also about the myth? One of the myths that you know that breast cancer, it can be genetic, right? And some of people, they think that genetic is 100%. Although genetic is higher percentage, it can be 60 to 80 for BRCA1, BRCA2, and by the way, it's not only BRCA1 and BRCA2, it's way more. It's more than 150. It was the beginning with the BRCA1 and BRCA2. And there is a congregate of genes that it's related to the uterus and ovaries, and some of them to the stomach and pancreas. It will come in syndromes, all related together, you know. And these will increase my chance to 60 to 80. You know what is your chance here in the room? Any of you, which is, we will remove that she is having a breast cancer. What is the chance you get a breast cancer? Tell me, what's your name? نعم? خضرة? Yeah, just tell me. Do you know what is the chance that you get breast cancer? Yeah. انزين 1 بسم الله عليكم يعني بس 1 in 8 she will have the risk of getting breast cancer. But this I'm talking about the average risk lady. It's like, what does it mean? It means that the risk is not more than 12 to 13%. Your average risk. What I mean by average risk lady, actually for the last 2, 3, or even 5 years, I start to segregate the patients. Yani all of you don't have the same risk, by the way. There are a high risk lady and there are an average risk lady. Do you know who's the, أنا غششتكم الحين. I told you one of the causes of like classifying the ladies of as a high risk. It was genetic, right? Genetic you as proving genetic. Okay, it will constitute around 5 to 10% of all breast cancer. What other causes make me at a higher risk? Excellent hormones, especially people who received the hormonal replacement therapy in the olden days. And some, by the way, a lot of people, they ask me, doctor, what about the oral contraceptive pills? These days, the oral contraceptive pills, although for me, I'm against using any of these, it will have a lesser percentage of estrogen and progesterone. The whole idea is the estrogen and progesterone. Whenever it's increased, then it will increase my risk factor. What other causes make you a higher risk or predisposing you to get a breast cancer? There is something called familial. Have you ever heard about it? Like you tell me, the lady, she will come to me, doctor, my aunties, they have breast cancer, my nephew, I don't know, this and this and this. But when we did the genetic test, it turned to be negative. There is something we call familial clustering. It's not genetics. I don't have like the Mendelian type of inheritance of genetics, but I have around, this group I have so many members of my family, they have breast cancer. So this also is equal to genetics. We have to take attention of the lady, and this constitutes around 15% of the ladies. And the most important thing is that you ladies, the average risk ladies, okay, most of cancer will come from this group, sporadic. The lady sporadic, it will constitute around 80%, 75 to 80% of all the ladies. The lady will come to me and tell, doctor, I have no family member with a breast cancer. She is the first, she's the index of all of them. She's not having any high risk. Okay, what other causes will also make me put في شيء احنا نسميه, there is something for me as a breast surgeon when the lady come to me in the clinic. شنو الأسئلة? Any of you came to me for a breast follow-up from here for a breast follow-up? None of you, right? So the ladies, when they come for me for a breast follow-up, I will ask her a couple of questions. And these couple of questions, not because I want to know about her life, no, I want to classify this lady in a group, high risk or average risk. I will ask her, are you married? طبعا the age, I will know it from the CPR. Are you married? Do you have kids? How many kids? Did you breastfeed them? What is the age of menarche? If she is menopausal, what is the age you were menopaused? You stop getting your period. Do you have any family member? First degree, second degree, It's all very important. And you have any comorbidities, any other diseases. Why is that? Because this, everyone have a scale. And this, if I calculate it on a scale and it turned to be 20%, then this lady is at a higher risk of developing breast cancer. Most of the ladies who are talking about the menstrual period, إذا ما فهمتوا medical terminology, just stop me and I will repeat it in Arabic, okay? People who don't understand, so you can keep with me, okay? We are talking about the period to start before 10 and finish after 55. We are talking about the ladies at higher risk, the ladies who are married more than 30 and they are never having kids, because all of this, because these ladies are menstruating more, they get their period more than their estrogen and progesterone higher in their body. So القنبلة الموقوتة, the very is the estrogen. So always we are talking about reducing the risk. It means reducing the estrogen level, okay? What other risk also I will consider it? Ladies who did biopsy. تعرفوا شو biopsies? Biopsy يعني عينة من الثدي. I did it for example 1 or 2 years. It turned to be negative, not malignant, but it was of one of the proliferative disease. For example, ductal hyperplasia, for example, lobular carcinoma in situ. These are all predisposition. So this will predict that in the future I'm like 10-fold higher, 10 times higher than the other ladies. Okay? The other risk also, you know what other risk also we are talking about? يلا فاطمة قولي إيه؟ يلا.
ممكن يكون obesity أو
Excellent. Absolutely, absolutely. Smoking. من how many of you smoking here? ولا واحدة. Right? No one? خلاص عرفتكم. انزين, smoking is very high risk, ladies. Especially smoking in a premenopausal. We are talking about the period when you are menstruating. If you are in your 20s, in your 30s, it's associated with the most highly aggressive tumors, the triple negative and the Herceptin positive. I don't think you need it. If you are smoking, just try to quit it, okay? And obesity. You know why obesity will increase the risk factor of a breast cancer? No? Any idea? انزين. Any idea? لا تغشين، انت غش لا خلاص هي يعتبر غش. No. They want somebody who never heard this piece of information before. Ladies, yalla, tell me. Why when I'm obese, I'm more exposed, and this is a fact. By the way, obesity will increase significantly the risk of breast cancer, especially in postmenopausal women. Why is that? خلاص أقول لكم تتكلم أنزين. It's because fat cells will be degraded. This is in term اللي ماخذ biology ولا ماخذ هاي الأشياء chemistry into estradiol. Estradiol is the final product, and it's exactly عيال عم مع الأستروجين. يعني مثلا if you are getting مثلا augmentin, it is not there, بيوصفون لنا another medication, they will say it's from the same brand. So it means that when I am obese, I have more estrogen in my body. And when I have more estrogen in my body, then I have what? Higher risk to develop breast cancer. What other risk factor we are talking about it, apart from that? Exercise قلنا body weight, obesity, قلنا family history, قلنا genetic factors. What others? The age. When I'm old, I'm not trying to put it in slides, by the way. I'm trying to put it more interactive. Age. When I'm older, I'm more prone to get cancer. And the most important, that being a female. Being a female, because 99% of all breast cancer would tend to happen in a female, while 0.5 to 1 in a male. It can happen. It's not zero risk in male. It can happen, but it's not as common as female. What other risk factor? في شيء نسينا? What other? Alcohol. Excellent. Alcohol will increase. Even, by the way, some people, they say no, we are social drinker, we are taking only 1 cup. They found that even 1 cup of alcohol will increase significantly the risk of breast cancer. It's not like the amount, if I'm like alcoholic or not. Even the social drinkers are at higher risk of developing breast cancer. One of the new things that they are talking about in terms of breast cancer risk, and you will get surprised, diabetes, hypertension, and hyperlipidemia. Do you know that these will increase the risk factor? They are called it recently the metabolic syndrome, المتلازمات الأيضية. Because, and you can see that, because when everybody talking about the figures of a breast cancer in the region, they are telling it's related to the lifestyle, related to the food, and related to this endocrine syndrome, اللي احنا نسميه, or the metabolic syndrome. Because all of you have family members with, and most of it will come in a triple, like diabetes, hypertension, and hyperlipidemia. Diabetes will increase the risk factor. تعرفون ليش شلون الدايابيتس will increase the risk factor? Wide هادئين اليوم, so quiet. I want even a wrong answer. Just give me an answer. Why diabetes you feel like it will increase the risk? شافوا إنه they did a study, and they saw that women who is not having diabetes will have reduced risk by around even 15 to 20% of the ladies who are having only breast cancer, or having diabetes. And especially we are talking about diabetes type 2 and uncontrolled diabetes, okay? This is because of hyperinsulinemia. You understand me? Well, I have to repeat in Arabic. متأكدين all of you? انزين, it's called hyperinsulinemia. And you know what? يلا فاطمة قولي لهم, what is the insulin? What is considered to be the insulin? Belong to which group? It's hormone, growth hormones, yeah. Insulin, right. Insulin is a growth hormone. A growth hormone, it means what? It means that will enhance the cell to proliferate. So it will proliferate, and at the same time, it will inhibit apoptosis. So I have a lot of cells which is not dying, and it's going and destroying the normal cells. So this is the mechanism. So I have a favorable environment for tumor cells to be initiated and to start on this. And the other theory, they are telling about the insulin resistance, and of course all of you know. And the third thing is because causing inflammation. For the hormone, the insulin hormone, to be elevated long time, it will cause sort of inflammation. And the inflammation environment, it's always the most preferable environment for what? For cancer cells to grow. And hypertension also uncontrolled. By the way, not to get scared, we are talking about uncontrolled diabetes, we are talking about uncontrolled hypertension, okay? Hypertension also, when it's uncontrolled, it will cause also what? Breast cancer. It will increase it by around 10%. Why is that? They found it has the same principle of diabetes, and it increased the inflammation, okay? And hyperlipidemia, but to a lesser extent. Ladies, do you know that vitamin D deficiency will increase the risk of breast cancer? Are you aware of that or not? Everybody now these years, they are talking. There was a big study, it was carried in Abu Dhabi, and they said that maintaining a level of vitamin D above 75 will reduce my risk by maybe 40%, 30 to 40% of getting breast cancer. فيعني if you are high risk in some of the things that you can't change, like genetics, like the age you got their period, the age your period stopped, then you can reduce it in another side, right? Like exercise, like maintaining your BMI, eating well. طبعا food, I will not talk about it because Sarah, she will give you a beautiful talk about it. And that's why I mentioned that last time, that we were talking about healthy food first, vegetable and I don't know, and these things. Then we start to talk about anti-estrogenic food, and then they replace the name with anti-cancerous food. And now, Sarah, what we are talking about? We are talking about anti-allergic food or inflammatory food, because the diabetes and the hypertension, it all creates sort of inflammation and allergy, and certain food will suppress this allergy. You'll talk about this, right, in your presentation? Yes. What other risk, ladies? All of you have it, and it's not less important than the rest. I mention it. All of you have it. Since you wake up in the morning until you go home, especially if you are in a big working environment. Stress, exactly. I was surprised, none of you mentioned stress. Before we mentioned stress, and we are saying, okay, stress, they are spoiled girls, they are telling stress. No, it's true. Stress has a direct cause and effect with the breast cancer, and I keep on telling about the study about us. Fatma, are you aware about this study? They found that the doctors, but I don't know, before we used to take night duties for a long time, but these days we don't. They found that works that require working in shifts that you don't sleep at night, like doctors, nurses, they will have higher risk of developing breast cancer. يعني in sleeping at night, when everybody is sleeping, when it's dark, is advantage. فيعني if you have this advantage, please use it. Okay, لا تسهرون ل 3 or 4 o'clock and then try to sleep, because it helps to maintain the circadian rhythm of your cortisol, and then maintain your health, maintain the level of the cortisol normal, and then reduce your risk. Any risk we forgot to mention it? Yes.
The size of the breast actually matter. Like if someone has more fat cells, do they mean that they have higher risk?
Thank you very much, Sarah. This will lead me to one of risk factor I was about to forget about it. What it's matter is not the size of the breast. What is matter is the type of a breast. And this I keep on mentioning it to my patients, the audience, everywhere I go. It's the type of cell. Recently, we are talking about dense breast. Actually, it's your right, and all my patients, when they come to me, all of them, I tell them what is their type of their breast. We are in an era, you should know, any of you know the type of their breast, and my patients, all of them, the type of a breast, you know it as an ACR from the mammogram. Type of a breast is A, B, C, D. It is A, B is considered to be fatty breast, Sarah, if this answer your question. And fatty breasts, they are at a lesser risk, not for any reason, but because the screening, أنا أسميه transparent breasts, the A and B, because it will be transparent, everything will be clear. So we are not missing anything. While before, they are using only mammogram and the traditional mammogram, so it's quite, and it's like in the dense breast, most of the tumor tends to camouflage within the breast itself, so it will pretend like it's part of the breast, but it's not. There is a tumor, but we are unable to figure it out. But I feel, according to the study, dense breast will increase your risk 4 to 6-fold higher than the normal ladies. But my personal, personally, I believe that this is because of the cancers are not diagnosed quite early. So if the patients come with a dense breast, this is an increase in the risk. So what is the screening modality? You know what? Screening. الفحص الثدي, what is it? When we are talking about screening, it will come to your mind? Excellent. Before, everybody telling mammogram, but these days we combined, and I've been in practice, not these days, I've been in practice long time back, and always I combine, because especially the screening group, the people whom I will screen, they are the younger age group, who's like from the late 30s, 40s and 50s, and most of them, like at least 50% of them will turn to have dense breasts. So mammogram by itself is not enough. Although we have now, do you know that the mammogram is different type? ولا بس يقولوا لكم mammogram وتروحون ولا تسألون, and you never ask what type of mammogram they offer me? Oh my God. انزين يلا بقول لكم I will tell you the information. There is the standard mammogram, which is the first generation, the 2Ds, and today we are talking about all our patients. Actually, I offer them the 3Ds mammogram. We have it. 3Ds mammogram, it's either the tomosynthesis or the one which I really love is the contrast mammogram. Contrast mammogram, especially for young patients before 40, and they are having genetic or very strong family history of CA breast, or even personal history, so we can follow up for, it has like a sensitivity of 98%, approaching the sensitivity of the MRI, and especially practical for ladies who are having phobias from MRI and these things. What is the age we should start as a ladies doing screening for the breast? هاي easy. Huh? انزين انت 20, she said 20, and you 40. في بعد age مختلفة؟ ها؟ Okay. ترى both of you is right. اللي قال 40 is right. واللي قال 20 to 25 is right. So that's why I'm telling you, when the lady come to me, I segregate them in high risk patients and low risk patients and average risk patients. High risk patient, for example, she غادة بتسيلي بتقول لي we have genetic mutation in my family, doctor. So I will be very careful and I will start to screen the girls at 25. And then you will tell me, but doctor, mammogram is working with the fat. You know the mechanism of mammogram, that it will highlight the abnormality within the fat. And when we are talking about 25 years, so it means that she's having very dense breast. Even her breast is very few fat cells. So what I will use? Actually, this is very important, that 40 is not anymore is the magical age for all screening program. Screening program for the average high risk patient will start at 40. But for the high risk patients, I have to segregate and categorize and personalize for each one. People who come with genetic, I will do it for them at 25 years old or 20. And we can use the MRI because the MRI is very good, or these days the contrast mammogram. It will highlight everything, it will map everything within the breast. But 40 for the average ladies. And when she come without genetic, but she told me like I have a family history, like my auntie, she had a breast cancer when she was 40, then I will start her the screening 10 years younger than the age of the youngest affected member of the family. Although I will do a mammogram as a baseline, but it won't be a very informative at the beginning when I do it, but later on, when she had any abnormalities, it will be a very valuable tool for me to compare it with the previous one. You got it? And so you know now it's not only one type of mammogram, it's different generations of mammogram. I can use mammogram, ultrasound, most of the time I combine it with ultrasound, and MRI. As I told you, MRI is important. One also of the risk factors or the math, a lot of people talking about implant. Nobody asked me about implant. Everywhere I go, they ask me about a breast implant, except here. Why, ladies? Do you feel that a breast implant will increase your risk of a breast cancer? Yalla, jawabay. Do you feel that?
Well, I read something about
what you read.
People with it causes like constant inflammation. Like it's attacking something as long as the implant is there.
Yeah. See, part of it is true and part of it's wrong. Actually, it's yes and no. No, because most of the breast cancer are like ductal and lobular, okay? And they found, and the breast cancer which happened from the implant, it can happen in 0.0005% of all the population. And they saw that it's related to one type, maybe because I'm working with implants, we have two types of implants. We have something called the smooth and something called the textured. From beauty side, the texture is more beautiful. It gives you the best contour, but they found that it's associated with increased risk of lymphoma. Acute lymphocytic lymphoma, the very rare type of lymphomas, and some of them they said no, it's related to immune, but If you want the right answer, it's no, because this is a very special situations that patients will get lymphoma and not the usual breast cancer, which is constitute more than 99.5%. Okay?
Regarding the trauma,
trauma
to the breast,
Yeah.
meth or to?
It's meth. Trauma, most of the time, it will highlight something already existing there. Like بتقول لك إن مثلاً طقني يعني مثلاً يجون النسوان الكبار يقولون oh I receive a hit from my grandson, I receive from my son, and then there is a mass here. Actually the mass was there, but coincidentally with the trauma, or because the trauma, it will cause fat necrosis. Something, it's similar to it, but it will fade with time. It's like 1 month, it will go. But if it's not going, it means that the trauma was on something already existing, coexisting pathology. Okay?
Doctor, you advise to do mammogram with contrast for diabetic patient?
We can do it like, we can deal with it like the same things we do with the CT. But we have the tomosynthesis also good. It's not contraindicated, but they have to stop the medication before that, like the way we are dealing with the contrast. Any contrast, they will give them instruction, but it will not increase their harm if they have a good renal function test. Okay? What else also you have questions? Actually, I don't know what is in my presentation. What is it from? Let's go through it. Yes. How is the breast cancer present? Actually, one of the myths that all people talk about is that breast cancer can present as a mass. This is the only presentation. Do you agree with this myth or not? Actually, breast cancer can present with different things. يلا نيمت ترى أنا بارقد الحين أنا بارقد أبي تفاعل يلا. How can breast cancer present? present يعني شلون شكله في البداية، شلون إنه يعني شنو نقوله بالعربي يعني لا شلون شوفوا عشان شيء قلت لكم بقول بالعربي شلون أول مظهر لسرطان الثدي يطلع. بعضهم يقولون لازم يكون غدة but this is not true. شنو ممكن يكون؟
هو بيكون خلية داخل وحتى غير مكتشفة وخبيث.
لا you didn't get my idea. Like you didn't get my idea. Just let me explain it for you. بعضهم يقولون إن الأورام الخبيثة دائما تجي على شكل كتلة في الثدي. هل هذا الكلام صحيح؟ لأن الأورام الخبيثة breast cancer can present نفس إفرازات من الحلمة. A bloody nipple discharge without any كتلة, without any mass. نعم؟ Exactly, it can present only changes and retracted nipple. This is the only presentation of a breast cancer. A breast cancer can present when I am standing, it's puckering like كأنه خفسة في الثدي. هذه, this is the only presentation in the breast. What other things can present? لأن some of them they said no, it's not a mass. Mass is not necessarily, although it's the most common presentation, but it's not necessarily to be the first presentation. It can present as a lump, lymph node in the axilla. Sometimes the primary tumor will not be like you can't feel it, and it's present as a reaction of the lymph nodes. What else?
Skin texture.
The texture, sometimes because of a tumor cell invading the lymphatics of the skin, it will give us the podorange appearance. You know, podorange appearance is like the orange skin. Okay? Sometimes it is present, sometimes it happens. Cases with Dr. Fatima, she sees them as a mastitis and inflammation, right? They will come for her as inflammation, a skin inflammation. She will give them antibiotic. It's not working. She will call me, Dr. Mariam, I need a bunch biopsy from the nipple. And it's happened. She sent me a couple of cases, bunch for bunch biopsy to rule out Paget disease of the nipple, right? What other presentation can it present? It can present simply as asymmetry. Asymmetry, the lady will present to me, doctor, I noticed that this breast within the last 2-3 months becoming bigger. What else? It can present as a pain. Pain, although more than 90% of patients presenting with pain having benign mastalgia, but they found that 10% they will have a serious pathology behind it. What else? Dilated veins. Dilated veins because of increased vascularity. This is quite common during pregnancy. When you are pregnant, this is very common that you have dilated vein because of lactating, increase the vascularity. But when you are not lactating, it should be an alarming sign. شنو بعد شيء تعرفونه أنا نسيت؟ lymph node, pain, pregnancy هاي ذكرناه نفهم. Okay, risk factor, I think we've been through it, right? I mentioned most of it. هاي تكلمنا عنه. تكلمنا عن الايميجينج. طبعا احنا we are talking about a triple assessment. طبعا هاي من سنة يدي. من early in this century we are talking about triple assessment. هاي ما تغير. This fundamental triple assessment screening ما يصير بدون بس اروح اسوي اشعة. And by the way, ladies, I have very important take-home message. These days, you will find a lot of places they are promoting for ultrasound mammogram packages for this price. Ultrasound mammogram, including me, including النفيس, by the way. We are part of this campaign. It's not wrong, but the wrong thing that you go and do it in people who are not professional. And I insist that the surgeon, he should be a breast surgeon. They know what to do. They know what to look for. The radiologist, I can do the radiology, and it's the best technique in the world, and their machine is good, but by the end of the day, the radiologists, they can't interpret the radiology right, and then there will be misreadings, and then what? As if I never did the screening. So I make sure that I did the screening with people who know exactly how to read this X-ray. We are upgrading, you know, before we are not talking about it, just do the screening. Now, I have to do it, or I have to do it with somebody who, if everything is normal, I will tell you a simple story. I have one girl, she was at that time 30, this a couple of years back, she's 33, and she was treated by another surgeon in another hospital, and she did for her ultrasound and mammogram and keep on repeating her the mammogram she presented to the dermatologist as skin inflammation, which is not going. And then the doctor have labeled her as an eczema. The patient came for me, and by the way, this surgeon, they never thought about doing her, they just going in the same vicious circle. Ultrasound, mammogram, there was nothing. She's young, her breast is dense, maybe she's having 0 fat cells. It's not, nobody will have 0, but it's very less. So neither the ultrasound is an operator dependent. If the person, he's not specialized or she's not specialized, then I will get the false reading. And she came to me, and I noticed that there is a huge tumor occupying the whole breast. And she is telling me that this allergy, doctor, but I came for a second opinion for you. Immediately, what do you think I did for her? As an upgrading of my service. Since I have ultrasound and I have mammogram, no, I did an MRI. MRI have showed the most aggressive and the biggest tumor with lymph node metastasis, with lung metastasis, and she was treated for the last 1.5 years as skin allergy and eczema. So this is the point I want to highlight about it. What is the time, ladies? Because 11 I have to go. And then this is the triple assessment. This is the screening which I was talking about, and I told you there are different generations, and in the western part now, all of them, they have shifted to tomosynthesis and to contrast mammogram. So rarely they go for the 2Ds. My friend, Dr. Christopher, he's the head of surgical department in Yale in the States, and he told me, for example, they can do the 2Ds. For example, 1 year, And a lot of ladies, a lot of you ask me, Doctor, 2 years or 1 year? Personally, with the youngest age here, with the high prevalence, with the so many risk factors, I rarely go for 2 years. I feel 2 years is long. And by the way, the state, all of them, they are telling from 40 to 54, you can go for yearly, and then from 55, you can go for yearly or 2 years. Personally, I don't prefer 2 years, because when I dig in the history of any patients, most of them, they have family members. So why to go to, and the disaster that one patient, she has a personal history of a breast cancer. She was operated, although 6 years, and her doctor, she told her, she's not a surgeon, but she told her, no, you can go to 2 years. I think this is a disaster, okay? Because herself having a breast cancer is a risk factor to develop a future breast cancer, right? It's either in the same breast if it is breast conserving, or on the other breast if it's mastectomy. Okay, you got it? And what else? Prevention. What is the prevention? We are talking about it. How I prevent myself from getting breast cancer. Already we talk about it. Healthy food. Sarah, she will talk about this part. What else? Exercise. And I told you about the magical formula for exercise. 150 to 300 minutes per week for moderate exercise, and 55 to 150 of vigorous exercise. This is the magical formula to maintain healthy. What else? Okay, genetic test. What else? Extend breastfeeding. Actually, this is a very valid point. Being like a working mother, I feel it's difficult, including me. I have 3 kids, and we never had the chance because I have to go back to work, you know, but this is not true. The right thing is that breastfeeding, not 6 months, not 1 year, they figured out that it's like what is mentioned in Quran, حولين كاملين. It's 2 years. 2 years which would reduce the risk factor, nothing less than that. Okay? And what else? Breastfeeding. Smoking cessation, excellent. And by the way, smoking, does it mean that, what is it called, vape? Most of the girls now, they are not considered as smoking. This is smoking. And this is even worse than the cigarette smoking, okay? And shisha and all these type of smoking. I'm against it completely. Okay, what else? Eating well, exercise, maintaining a healthy, a good weight, okay, and an optimal BMI. What else? Breast self-examination. Excellent. We have a video. I will leave it for you, but because for the breast self-examination, you know how to do the breast self-examination, right? Yeah, you do it. How many of you raise your hand? Who's doing it? Okay, who taught you to do the breast self-examination? Yeah, you have it? خلاص, we'll distribute it, okay? And there is a video. Yeah, you give them. يلا غشوا وكون عندكم هذه. يلا قولوا. إنزين, who taught you to do the breast self-examination?
I was actually consulting one of the doctors, and then she told me how to do it. But I searched also more in YouTube videos and read about it. And
so you educate yourself.
Yeah.
So what day?
These campaigns and lectures.
Which day of the month you are doing it?
A week after mine.
A week, exactly. So we have 2 groups of females. There are females who are not menstruating. If she is not menstruating, but still, she is having a smaller dose of estrogen and progesterone. So for example, and the breast will keep on changing during the month. So keep, for example, first day of every month, like or first or second, but it should be the same date to notice the changes in your breast and to be the same. And by the way, the first time, it's always you are using في video. Can you put the video? يلا أنت مريضة. Can you put the video? Video for the breast self-examination. محمد. وين البنات؟ أبرار كانت معنا آخر مرة. وين أبرار؟ طبعا البريست self examination, it should be under the mirror. You should stretch your arms, okay, and you should look for any buckling, any tethering, and you look in the mirror for changes. It's not only examination, it's looking also. If there is any deformity, if there is any swelling, if there is any discrepancies, if there is any retracted nipple discharge, okay? Yes. بس عمال الصوتي ده, okay? No, not this one. This one. Check if the voice is good. If the voice is good, then I will leave you with it.
Hello and welcome to the...
Yes, okay? Just stop it and then hurry. Okay, just focus on what he or she is telling, I don't know. And then, but I found it very informative video about, because the idea before they are telling, well, I don't know. And then the idea before they are telling you are examining. The most important, it's not examination, it's you see also, you see. You check, you watch, and it's important to know when to examine the breast. It should be after the period. The estrogen, progesterone have to return to normal. So all, because you know that during the period, the body will preserve all the fluid because of the retention. So I need that it all goes, so it will be easy for me to detect any abnormalities. And the last take-home message for you today, before you go with the video, is that don't get depressed or upset. Dr. Fatima, the first time you did the breast, did it make you frustrated that, okay, I don't know what I'm looking for? Did you have this feeling? What you felt exactly? Yeah, what I'm looking, so I can't find any abnormalities. So please bear up with the breast self-examination. Not the idea. The idea is not to know what is normal and abnormal from the first time. You have to do it at least 10 times before you know what is. It's just ta'aruf, you know. I want to know my breast. For example, here there are nodularity all the time. Here there is depression. There is here soft. This always I feel it, and then it makes it easier for me after 10 times to know what is normal. Okay. Thank you very much. It was a pleasure for me to give you this talk.
البارت الثاني الأخصائية التغذية العلاجية الأخت سارة سعيد. أنا عن نفسي أعرفها من بودكاست مشهورة، يعني هي دارسة في قطر واشتغلت هني في النفيس وردت اشتغلت في قطر ورجعت الحين بالنفيس مرة ثانية. فما شاء الله عليها، لما تشوفون عندها صفحة بودكاست مشهورة يعني ما شاء الله. كلنا نبيها طبعا لأن احنا أهم شيء عندنا التغذية. حياة سارة.
And hello everyone, my name is Sarah Saeed. As she mentioned, I'm a clinical dietitian at the Nefis Hospital. I'll try my best to make this quicker, and I'll try to focus on the things that will benefit you the most, okay? Well, I've seen a lot of, I've done a lot of presentations about breast cancer and food, and I decided that this time I wanted to do something that, that gives you a straightforward take-home advice, something you can actually apply in your day-to-day life. Like, I can sit here and tell you what's good and what's bad, but I also want to give you an advice of something that you can actually go and apply at home. So we're going to talk about ways not to prevent, but I would say to reduce the risk of breast cancer. And then we will discuss some myths and facts about food and breast cancer. So as Dr. Mariam mentioned, she mentioned the BMI. So one of the risk factors that increases the risk of breast cancer is actually your body weight. As she spoke, is about obesity. So one of the ways we can check if you're within the normal range of weight is by using the BMI. So basically BMI is a tool we have to estimate the amount of fat in the body. So this is just an estimation. This is not an accurate result. If you want to know exactly how much fat you have in your body, you must do a body composition test, which is basically the Sika machine. Has anyone here have done Sika or in-body machine before? No? We actually have one in the back. So after the lecture, we can go get your you can get your body composition. You can check how much fat exactly in your body. Another way we can get the amount of fat in the body, or let's say in the area that we're most concerned about, is basically the waist circumference. So I always tell my patients, we can check your BMI. It's a good tool, but it's a very misleading tool, especially with people who exercise a lot. And then we can also check the fat percentage. So for women, it needs to be less than 31%, But still we don't know if the fat, where's the fat concentrating exactly. And the most concerning fat, the fat that actually plays with your hormones, is the fat that is in the midsection. So the mid part of your body. This is the fat that is most concerning for all of us. So whenever someone comes to me in my clinic, I always check their waist circumference. So if the waist circumference is less than 80 centimeters, it's actually good, which means we don't have a lot of excess fat in the midsection, which is basically what we call visceral fat. So visceral fat is fat around the most important organs in the body. So it's around your stomach and lungs and etc. So if you have a good waist circumference, even if your fat percentage is a little bit high, I don't have a concern. But if it's vice versa, let's say your fat percentage is actually normal, but then it's mostly concentrating in your stomach area, then this is more concerning to me. So keeping a healthy weight, how can we keep a healthy weight? This is a really good question. Have any of you done a lot of diets before? So what type of diets have you done before? Can anyone tell me? مجاوبين على فاطمة اليوم. So what kind of diet did you do?
When I was younger, not product, it was crash diet.
Crash diet. So what type of crash? Which one? So many.
I tried vegetarian.
Okay.
I tried
Oh, okay. So different types of diets. Have you guys tried keto? Can you raise your hand if you did? Keto, intermittent fasting. No one? Intermittent fasting? Yes? So متقطع. Have you done it? Okay. So
There's something called egg diet.
egg diet, yes. So egg diet, carnivore diet, they are all revolving around the same idea that we're going to consume high protein, high fat diet, and we will eliminate something like bread and all kind of carbs, bread, fruits, and etc. So one of the best diets that has been ranked the best diet year after year after year is actually the Mediterranean diet. And this is why I was telling you, I want you to learn today a diet that you can actually apply in your day-to-day routine, and it can actually lower your risk factor of breast cancer. So Mediterranean diet is that diet. It's really good for people with hypertension, people with diabetes, people who have high cholesterol, dyslipidemia, and etc. Even insulin resistance. And why is that? Because the Mediterranean diet, it consists of high amounts of legumes. So we actually concentrate on consuming a lot of legumes and replacing the animal-based proteins with plant-based proteins. Legumes are amazing for the body for so many reasons, because they are high in fibers, they are high in antioxidants. It's actually considered one of the anti-estrogenic food. And I still didn't know what they call it in Arabic, but I can explain it. So anti-estrogenic food is basically food that lower the effect of estrogen in your body. So if there's any excess estrogen in your body, these type of foods will help you get rid of it. So that's the anti-estrogenic food. And one of these foods are actually legumes. So we have different types of legumes. One of the legumes that is considered one of the most effective one is actually soybeans. And they've done so many studies, it's based on studies, they've done a lot of studies in Japan and in Korea, and they noticed because they actually consume high amounts of soybeans, they have lower risk of breast cancer in that part of the world. That's along with, of course, familial history, like their genetics and their lifestyle. It's not just about the soy, but it's one of actually the benefits that they have. So if you want to have a Mediterranean diet, you want to consume legumes. So how many times you will consume legumes per week? She attended it before. So how many times I should consume legumes per week? How many meals? Just give me any number. 3 to 5, okay. 3 times. 3. Okay, so we have the beginner version to do this, and we have the advanced version. So if you are a beginner, you don't consume legumes on the regular, I would say have it 3 times a week. So we have 3 meals a week. They're gonna be plant-based. If you wanna go follow the advanced version, we're gonna have how many days? No, 2 days. 2 full days, plant-based 2 full days. So you will have plant-based breakfast, plant-based lunch, and plant-based dinner. So you have 2 vegetarian days, and then the rest of the week you will consume animal-based proteins. So chicken, shrimps, and beef. So that's the advanced version. So the first point we want to learn today is that if I want to lower my risk of breast cancer, I should be consuming legumes. So 3 times a week, or 2 days, 2 full days. You will consume only plant-based proteins.
Good question. Those 2 days, do they have to be consecutive or apart?
It's up to you. I don't mind if they're consecutive or if they're apart, it's fine. Okay. One other things that we actually focus on in the Mediterranean diet is actually the Mediterranean diet high in seeds as well. So they consume a lot of seeds and a lot of nuts. This type of diet includes a lot of seeds and nuts. And seeds and nuts are also considered one of the anti-estrogenic food. So to go back to the previous point, me telling you just follow a Mediterranean diet, that would make it so much easier for you to consume high amount of anti-estrogenic food without actually thinking about it. Because whenever my patients come to my clinic, they're like, okay, so I need to consume cauliflower and I need to consume some berries. They just get very confused because they're trying to include bits and pieces in their diet. So to make it easier, just follow a certain diet that focuses on these type of food. So seeds and nuts are also anti-estrogenic food, especially flaxseed. So flaxseed is one of the foods that are considered that it actually detoxifies the liver, so you can get rid of the excess estrogen in your body. So that's the benefit of the anti-estrogenic food. So any excess amount, your body is just, yes, exactly. It just gets out of your body. Okay. Another thing is we want to consume a lot of fruits and vegetables. So how many servings? It's there. 6. We need to have 6 servings of fruits and vegetables a day. So I love to divide it 4 servings of vegetables and 2 servings of fruits. And I want you to eat the rainbow. I want you to eat multi-colorful fruits and vegetables, not just one color, because each fruits and vegetables, they have their own benefits. So something like oranges, it's high in vitamin C. So any food that is high in vitamin C is considered an anti-estrogenic food. So all the citrus fruits and vegetables, they are actually anti-estrogenic because they are high in vitamin C. Another fruit is berries. So something purple. All the purples, they are very beautiful because they are filled with polyphenols, such as flavonoids. And these are the ones that also detoxify your body from excess estrogen. So that's why they are anti-estrogenic food. We also have one of the best ones, the cruciferous vegetables, which is basically broccoli, cauliflower, what else? Brussels sprouts. Do you guys know the vegetables? Because I see you all quiet. So these are one of the best also vegetables that you can consume because they are also considered an anti-estrogenic food. So if you consume cauliflower, broccoli, you include berries, you include oranges, you include apple, just like I said, just include a beautiful rainbow into your diet by having it 6 times a day, not a week, a day, 6 servings a day. You will definitely be an anti-estrogenic diet. You wouldn't even worry about that. One other thing is by basically including dairy products into your diet that are low in fat, low in saturated fat. And the other day somebody asked me, can I consume like a whole fat milk, like not low fat or fat free? Yes, you can of course, but make sure that you don't exceed 10 to 20% of your calories from saturated fat. That's why we always take low fat dairy products, because most of the people, they actually consume a lot of fat in the other food items they're consuming. So let's say they had a steak for dinner, they had, I don't know, let's say machboos for lunch, and they added a lot of butter in it. So, you know, you're having a lot of saturated fat in your diet automatically. So that's why we always like to have low fat dairy products. So whether it's cheese or milk or yogurt, we're gonna go low fat. What about dairy products that are high in probiotics? Do you think they're good, or do you think they actually play a role here, or it just doesn't matter? Yes or no? It's a yes or no question. Yes or no? Okay, so yes, it does actually. So dairy products that are high actually in probiotics, they're really good for you. Okay, so something like الكفير. Do you drink kefir milk or kefir product? حليب الكفير. سمعتوا عنه؟ حليب الكفير. حليب الكفير is one of the best ones actually. So you can consume حليب الكفير مثلا is one of the best one. You can consume yogurts, لبن. They are high in probiotics. So you can actually mix and match. So you can have low-fat dairy products, and some of them, sometimes you can consume high probiotics dairy products. Okay? We will limit any cured processed meat. So anything like sausages, pepperoni, salami, where they call them the charcuterie boards, where they put all of these deli meats on top of it. Deli meats usually are high in nitrites and nitrates, and these actually play a major role in the risk factors of breast cancer. That's why we try to avoid them as much as we can. Some patients ask me, what if I had them like once every 2 months? What do you think? Is it fine? What? Fine or not fine? Probably not fine. I wouldn't prefer it, but if somebody consumed it once every blue moon, it's not gonna be a big deal. Okay? So once in a blue moon, it's fine. But consuming it on a regular basis, that's the problem. Okay? We want to focus on lean meats and lean proteins. And when I say lean, I mean we will try to have the healthier cuts of the chicken or beef or etc. So if you're consuming something like chicken, which part would you consume? That's the easiest answer. A breast. So because why do we choose chicken breasts? Less fat. We have less fat in there. One of the questions that I also get, I saw a patient. She stopped eating poultry and she stopped drinking anything that comes from like animals, like let's say milk as well. So she stopped milk. Bernard. Okay, so she stopped milk, she stopped drinking milk, and she stopped eating poultry. And she told me I stopped because they are treated with GMOs and they have hormones. And these hormones will affect my hormones, and then I will get breast cancer. Do you think that's true or false? Who says it's false? Just raise your hand. Who says it's false? Again, the question? Okay, so a patient came to me, and that's a true story. She came to me and she stopped drinking milk, cow's milk, and she stopped consuming chicken because they are genetically modified organisms, okay? So GMOs basically. And she said that because they are treated with hormones, it will affect her hormones, and then hence she will have higher risk of getting breast cancer. So is this true or false? Who says it's false? That's the question. It's okay. It's okay. If you said it's false, then it's wrong. It's false. It is false. You shouldn't be hesitant. It's false because anything that goes into your body breaks down. So if you consume it, let's say that any GMOs. Because a lot of people have misconceptions about GMOs. Genetically modified organisms, they affect you badly, not because they have hormones and the hormones will be in your system and then the hormones will act up. No, they will affect you because the composition of the food will change to begin with. That's the problem with the GMOs. No, so Okay, this is like a general information. Anything that got modified, so let's say chicken or vegetables or etc. Let's say, you know, they're GMOs. They're considered GMOs because they were treated in a certain way to give you a certain product. That's what GMO is. يعني مثلا الخبز, القمح, wheat. The wheat you consume today is different than the wheat we consumed before. Why is that? Because they were treated with GMOs, basically. They're genetically modified organisms. So they were treated in a certain way to make wheat produce more quantities than before. يعني بدل السنبلة مثلا الحين يعطيش 10 سنبلات الزرعة الواحدة. Because it was treated. Okay? That will affect you in a way because the composition of the food changed. So the gluten amount, let's say it was 10%, today it's 50%. That's why a lot of people have issues with the gluten. So it's not because there are hormones and the hormones I'm consuming and suddenly it's playing with my own hormones. No, it's because the food composition actually changed. But anyways, so it's false because anything that you're consuming, let's say that I'm not gonna consume the hormone, I'm gonna have the hormones from the chicken. No, your body will break everything down eventually. So hormones are proteins, gonna break it down and absorb it وخلاص. So it's false. And when it comes to proteins, so we're going to consume proteins that are high in omega-3. So we have salmon. Salmon is an amazing source. We have tuna. We have markle fish as well. Omega-3 is an antioxidant, and also it's considered an anti-estrogenic food. How many times we will consume salmon or fatty fish per week? Twice. So 300 grams of cooked fatty fish. That's your goal, 300. Did you guys memorize the numbers? You're gonna go home and you're gonna try to apply them. Did you memorize them? Did you memorize the numbers? Not all of them. So how many times are you gonna have legumes? 3 times a week. How many servings of fruits and vegetables? 6. How many times of fatty fish? 2. How many grams is that? 300 in total, 300. And we will focus on fish and poultry and eggs the most. How many times you will consume red meats? Once. And we also talked, Dr. Mariam also covered this part as well, which is basically physical activity. So the previous part we were talking about the Mediterranean diet. Why should we follow a Mediterranean diet? And we know why, because we memorize the numbers, right? One of the other things you need to do is basically physical activity. So again, 150 moderate activity, 75 vigorous activity is good enough. But if you want to lose weight, you need to do more. So that's also another advice. If you need to lose weight, you need to do more. Breastfeeding as well, she also talked about that. Okay, so I want to play with you guys a game. So you're gonna say, is it a myth or is it a fact? Yes. I'm trying to go as quick as I can. So is it a myth or is it a fact? Okay. So the first one is evening primrose oil. Do you know what's the evening primrose oil? So do you know that? Do you know that? Okay, you don't know. So evening primrose oil is one of the oils that we actually recommend for women who are postmenopausal because it can actually regulate the symptoms of menopause. Okay? So evening primrose oil will lower the risk of breast cancer. Is this true? Is it a fact or a myth? Who says it's a myth? Just raise your hands. Who says it's a myth? So all of you think it's true? Who think it's true? It's a fact. And the people in between, they don't know? Okay, so it's a myth. It cannot prevent. There are no such studies about evening primrose oil and the risk of breast cancer. And this is one of the, by the way, it's a very common misconception because I see it in the clinic. Because a lot of the patients I see, let's say they are older, they're postmenopausal, so they're taking it and they're thinking that they're preventing breast cancer as well. But it's not, it doesn't work like that. It doesn't prevent breast cancer. Okay, supplements like vitamins and antioxidants will also lower your risk of breast cancer. Is this true or false? It's true? It's a fact. Okay, so this is the tricky one. So it's a true and false at the same time. So if you have deficiencies, do you remember what Dr. Mariam said about which vitamin? Vitamin D. So there are strong studies about vitamin Ds. If you are deficient in vitamin D, you have higher risk of breast cancer. But if you are within the normal range and you're consuming more vitamin D, would it help you to prevent? No. It doesn't do anything. So when it comes to supplements, which one is the correct way to say it? Is it more is more or less is more? Less is more. Less supplements is more. So you're having a bunch of supplements, because I see people come to me with 12 different packs of different supplements. This is for my sleep. This is some garlic for my hypertension. This is some steroids for I don't know what. It doesn't work like that. So your body is not just gonna absorb everything and be like, oh yeah, you found the magic recipe and I'm fine now. It doesn't work like that. So less is more when it comes to supplements. If you don't need it, we don't use it. I have good amount of vitamin D, I'm consuming more, I'm not gonna lower my risk more when it comes to breast cancer. You're already within the normal range, okay? Even when it comes to other antioxidants. So just like I said, some people have berberine, some people have AGCG, which is basically the green tea antioxidant. So more is not more, okay? Soy products. So soybeans, I've seen that a lot as well. So if you consume soy, I just said it a few minutes ago, but if you were focusing, you would know. Soybeans can reduce the risk of breast cancer. Is it true or false? True, it is true. I just said it, literally, about the Japanese study. It does actually lower the risk of breast cancer, and it actually has been proven. Cruciferous vegetables can lower your risk. It's true. We already said it as well. Foods high in probiotic can lower the risk of breast cancer. I want to hear you louder. Is it true or false? It's true. Because we already said it. And by the way, you can also get it from المخمرات. إذا تاكلوا مخمرات, you can get it from المخمرات. المخمرات are basically food that has been fermented with yeast and bacteria. So not مخللات, pickles, مخمرات, okay? Well, thank you guys so much. Do you have any questions?